Welcome aboard the Optimal Anesthesia Express, where we turn complicated concepts into smooth journeys. Today, we're taking a ride through something every anesthesia resident needs to understand: venous return. So grab your ticket and hop on as we break it down for you. Venous return might sound technical, but let's think of it as passengers trying to catch a train back to the station, which is the heart. In anesthesia, how well these passengers make it back to the heart is super important because it determines how much the heart can depart. That's your cardiac output. If not enough passengers show up, the train can't leave at full capacity, which can lead to problems for your patient. Now, let's talk about the three key elements that influence how smoothly this train station operates: the mean systemic filling pressure, which is like the pressure at the ticket counter, controlling how many passengers can get in line; right atrial pressure, acting like the crowd at the train gate, holding passengers back from boarding; and venous resistance, the obstacles on the tracks, slowing down the journey. Together, these factors determine how efficiently the blood make it back to the heart and keep the whole system running smoothly. First, we've got mean systemic filling pressure, or MSFP. This is the pressure in the venous system when there's no flow. Think of it as the baseline pressure in your pipes. The amount of blood in the veins and how tight the veins are, which we call venous tone, control this pressure. In anesthesia, MSFP is super important because it's one of the key drivers of venous return. You'll encounter medications like vasopressors, which tighten the veins and increase MSFP, thus boosting venous return. On the other hand, anesthetics like propofol tend to relax the veins, decreasing MSFP and dropping venous return. This is why we sometimes see a drop in blood pressure after induction with propofol. Venous return decreases, and less blood gets back to the heart. Next station, right atrial pressure, RAP. If MSFP is the push getting passengers toward the train, RAP is the crowd at the platform door. When too many people block the door, high RAP, like in right-sided heart failure, it's tough for the passengers' blood to squeeze onto the train. That reduces the number of passengers reaching the heart, slowing the whole process down. But if the crowd at the door clears up, RAP decreases. Like when you give vasodilators, it's easier for the passengers to get on board, speeding up the flow of blood back to the heart. The pressure difference between the line and the platform is key. You need a strong enough push to get passengers onto the train.
Now we arrive at venous resistance. Think of this as obstacles on the tracks. When venous resistance is high, the train has to slow down, making it harder for passengers to get to the station. The track might be bumpy due to a tight curve, increased venous tone, or because the train itself is overloaded, thicker blood due to dehydration. In some cases, anesthesia medications smooth out the tracks by relaxing the veins, lowering resistance, and letting the train speed up. But in other situations, like with a dehydrated or hypovolemic patient, the tracks get rougher and venous return slows down. Intrathoracic pressure acts like a yellow signal. Slowing the track's positive pressure ventilation reduces blood flow back to the heart, especially in patients with low volume or compromised venous return, requiring careful management. Let's sum up our ride. Passengers as blood travel back to the station as heart, helped by mean systemic filling pressure pushing them forward, while right atrial pressure either blocks or lets them through. The tracks, influenced by venous resistance, must stay smooth to keep things moving. In the OR, intrathoracic pressure acts like a signal, slowing the tracks and slowing down venous return. As an anesthesiologist, your job is to keep the trains running smoothly, ensuring passengers board the train, blood flow efficiently to maintain a stable system. Thanks for riding with us on the Optimal Anesthesia Express. Subscribe for more episodes on optimal anesthesia and keep your trains running smoothly in the OR.